Good evening, everyone, and welcome. And thank you to all of you joining us live tonight and to everyone who might be watching this webinar later via the website. I'd like to warmly welcome all of our panelists tonight, our presenters, and I'll introduce you to them shortly. Tonight's webinar is part of an FIP Transforming Vaccination Globally and Regionally series. This is Series 1, Identifying Transformation Needs, and tonight we'll be looking at transforming practice, a focus on strategy and policy for global change. Next slide, please, Emma. Thank you. Okay, so a bit of housekeeping before we start tonight. This webinar is being recorded and live streamed via Facebook. The recording will be freely available on our website at fip.org. You may ask some questions using the question box. The Q&A box is preferred during the course of the webinar. And we would welcome your feedback at webinars@fip.org. We welcome any constructive suggestions in any way that we might make these webinars better for you. We'd also encourage you to become individual members at FIP. That can be done at fip.org/membership registration. By being an FIP member, you will be able to access all the benefits that come with FIP membership. I should mention that these webinars are being presented with the support from an unrestricted educational grant from Pfizer. To introduce the moderators for tonight, my name is Paul Sinclair. I'm a community pharmacist based in Sydney, Australia, and I'm the chair of the Board of Pharmaceutical Practice at FIP. With me is Emma Polino, our professional secretary. Emma is a practicing pharmacist at her own community pharmacy in Portugal. She's general manager of EasyFi, a company that engages community pharmacies in the implementation of patient support programs. She is a member of the National Board of the Portuguese Pharmaceutical Society and represents this organisation at various international groups and organisations such as the Pharmaceutical Group of the European Union, PGEU, and the International Pharmaceutical Federation, FIP. Emma is also president of the Pharmaceutical Care Network of Europe, as well as being the professional secretary at FIP and a bureau member. Thank you, Emma. Next slide, please. Thank you. As mentioned, tonight we are looking at transforming vaccination regionally and globally. FIP's vision is a world where everyone benefits from access to safe, effective, quality and affordable medicines and health technologies. Our mission is to support global health by enabling the advancement of pharmaceutical practice, sciences and education. We are pleased to be delivering this event today titled Transforming Practice, a focus on strategy and policy for global change. This is a series titled Transforming Vaccination Globally and Regionally. This initiative involves a three-part series of 8 online events each, culminating in the signing of an historical commitment by FIP and member organisations to transform vaccinations globally and regionally through workforce enablement, addressing anti-science and misinformation, addressing vaccine hesitancy, and incorporating vaccination qualifications into pharmacist workforce education, both undergraduate and continuing development, to ensure all pharmacists in all settings are capable of delivering vaccinations as a standard part of pharmacist scope of practice. Today we'll be outlining the path taken to achieve successful vaccination programs by pharmacists in a number of countries and jurisdictions where they have existing or emerging pharmacist vaccination programs. Thank you, Emma. A brief look at the series of webinars. Series 1, which we're involved in now till the middle of October, is Identifying Transformation Needs. Series 2, from mid-October to mid-November, is Setting Transformative Goals, Deconstructing Vaccination in Pharmacy through the FIP Development Goals, launched last week across the entire profession. And Series 3 is Committing to Transformation, Delivering a Global Commitment to Action on Vaccination. Thank you, Emma. Some important links and resources that tonight and later you might find useful. And the resources at these various links are free. And the website best to access these is transformingvaccination.fip.org. I would also mention that all the events in this series are now open for registration, and we would encourage you to be a part of the entire journey of this series of webinars. Also tonight, we would like you to engage with us and help us answer the following questions. This can be done via the chat box, and just to record your thoughts and how you might address these questions. Firstly, what single factors should be prioritised to transform pharmacy vaccination services globally and regionally? What would be the most important achievement in terms of pharmacy vaccination services in your country in the next 5 years? If you do respond to this, I would just ask you to perhaps identify your country of practice. And what else should the FIP commitment to action outline? So give that some thought, and please use the Q&A box or the chat box to record those thoughts. Next slide, please, Emma. Today's learning objective is to outline and understand the path taken to achieve successful vaccination programs by pharmacists in countries and jurisdictions with existing pharmacist vaccination. So we move now to our first presenter tonight, and it's my pleasure to introduce Yong Pei Chin. Yong heads the pharmacy department in Woodlands Health Campus and is the current president of the Pharmaceutical Society of Singapore. With more than 20 years of healthcare experience in hospital management and community pharmacy, she held a diverse portfolio and had been instrumental in establishing new pharmacy setups and services, driving quality of care, as well as introducing innovation and technology in the course of her work. In recognition of this, she was awarded the PSS Johnson & Johnson Hospital Pharmacist of the Year award in 2018. On a personal level and society level, Yong is a strong advocate in promoting good health through public education to foster the right and responsible use of medications. During the COVID-19 pandemic, Yong has been at the forefront of delivering timely and trusted health medication information through various public channels, such as COVID-19 Mythbusters, medication ordering guides, disinfectant guides, and the importance of vaccination during a pandemic period. Welcome, Yong.
Thank you for the kind introductions, Paul. Good afternoon, FIP colleagues, or good evening to the Singaporean friends out there who is coming in to support me. So thank you for offering this opportunity to actually share with you about the pharmacist's role in Singapore and how we see the pharmacy actually can perform more than what I'm going to be sharing later. So next. I thought I'd start the presentations to just paint a bit of background on what are the impetus that actually drive the change of the vaccination policy in Singapore. In Singapore, actually used to be very much focused on the acute care services. We focus very much on the treatment of the ill, but with the aging populations, people living longer with the chronic disease, it's noted that it's actually increasingly unsustainable for us to actually operate in this old model. Hence, Minister of Health actually shared with us that we need to actually look at treat beyond, embrace some paradigm shifts. If I bring you to the attention of the circle on the left, on the one statement, which is move beyond healthcare to health, he shared that we should actually start looking at stepping out of the health promotion, starting looking at what are the disease preventions and helping the Singaporeans to actually support them in living a healthier life. Next. Okay. So with that, actually vaccinations, immunization become a focal point of review. In Singapore, actually, we do have a very comprehensive coverage of the immunizations. We have the national childhood to the adult immunization schedule for above 18 years old. We also have the school-based vaccination program, as well as strong mandates to actually to vaccinate our healthcare worker, especially during this COVID-19 pandemic situations. And these vaccines are actually very heavily subsidized for all Singaporeans as well as residents, and it even has a higher subsidy for the elderly. It can be easily obtained in the hospital, polyclinics, as well as even our private sector general practitioner clinics. But despite of that, even contrast to the childhood vaccinations, which has gained very much traction. If you look at the picture on the right, it's close to 100%. Our adult vaccination rate is only hovering about 12 to 14%, according to the 2016 to 2017 survey of our national populations health surveys. Next, if you can, yeah. So with that, in 2018, MOH actually set up a healthy SG task force. We've aimed to actually look at how to improve the adult vaccination by threefold in 5 years' time. Few things we'll look at in terms of step up of educations, reducing the financial barriers, and also making the vaccine more accessible. With that, actually, we felt that in the society, that the pharmacists definitely actually can play a role. We have always been involved in advocacy, which is motivating the patients to actually go for vaccine. In the public hospitals and in the community hospital, we work closely with our doctors and nurses to facilitate in terms of screening and identification of patients to go for vaccinations. But we felt that our community counterpart could do more than that. They have the advantage of actually about 160 of the pharmacy, and this is just the private pharmacy that in Singapore, namely the Guardian, Watson, and Unity, not even including the polyclinics, are spreading all around the island with extended hours, actually in the neighborhoods or in the heartlands, easily accessible for the patients and publics. We felt that they could step up actually to do, including the immunizer role, which is providing the injections. Next. So these are just some of the posters and materials that we actually use in our social media platform, as well as in our public campaigns. We actually also work closely with the companies to facilitate in terms of vaccinations by referral to our general practitioner. On the right-hand side, there are just some of the example of the hospitals working with the nurses and the doctors within the hospitals to actually try to increase the vaccination uptake. Next. But for us to transition fully to provide a full suite of services, right? What I mentioned, advocacy, facilitation into the immunizer role, actually we still have quite a couple of barriers that we need to overcome. In the next two slides, I thought I'd focus on these barriers and what are the proposed solutions that we look into to tackle it. So first up is the legislations. Our vaccines are currently classified as prescription-only medications. Henceforth, is only being able to be provided or supplied by the pharmacist with a prescription. And our community pharmacists currently are actually regulated by Health Product Act, which actually prohibit them to administer medications under these current regulations. The pharmacists also do not have access to the national immunization record, which we will actually document all the vaccinations for the patients. Because our community pharmacists, like I mentioned, the 160 of them, they are private sectors, so they do not access to our national contract as opposed to our public sector hospitals and polyclinics. So therefore, they may not be able to get a lower price. There will be some financial barrier. In addition, currently, as I mentioned just now, while it's heavily subsidized for the Singaporeans, and in fact, they can claim through MediSave, this route is only able to be obtained if you go to the public hospitals, polyclinics, and if you are a lower income earner, as well as if you are elderly with the what we call a community health assist card, or you are pioneer generation, which is the founder of the in terms of pioneer to the country before independence days, or 60 to 70, what we call medical generation, then you will get that subsidy. But this kind of allowances are not actually at this moment given to the community pharmacists in the private sectors. Secondly, I think for our pharmacy, we traditionally did not actually provide vaccination. So therefore, we do not have the proper setup that in place to actually give a conducive space to do the vaccinations. So this is something that also need to be looking at. When we actually survey the pharmacists, we also have variable confidence among us. Some express that if they do take up this role, they would like to have actually adequate training. So what are the ways that we have looked into and try to do it? So we have seen actually submit a sandbox proposal to Ministry of Health to actually let us experiment or trial this immunizer role. We request them to allow us to actually vaccinate under the Health Product Act, and also request for the vaccine forensic classification to actually change from the current prescription-only medicine to pharmacy-only medicine. Currently in Singapore, all the pharmacists, we are able to supply medications if it's actually classified under P category. We are not sure at this moment, although in our sandbox proposal, we didn't actually specifically request that it would be able for the patients to claim for MediSave. This is probably in conversations that we would like to embark soon with them, because recently, actually, they also announced in November that there will be an enhanced subsidy given and more subsidies will be, and the MediSave can be tapped on. So I think this will pose a financial barrier as well if patients actually seek out the service through the community pharmacy. In terms of proper setup, we have seen actually obtain a support from our pharmacy practice manager, who has in turn spoke to the management to actually agreeable to actually change the layout of the pharmacy to provide a conducive space. We have also got the support of National University of Singapore Department of Pharmacy, actually already rolled out a few sessions of the formal vaccination training using the existing curriculum, which is APHA, American Pharmacists Association curriculum. Some of the pharmacists are already actually trained and ready to go for this vaccinator role. Inside PSS, which is our society, we also have seen embark on a series of continuing educations to help the pharmacists to get updated on the recent changes in terms of the knowledge of the vaccine. Next. Aside from those barriers, there are two more barriers that we also have to look at. So first of all is the inconsistent vaccine documentations. Currently, as opposed to the childhood vaccination documentation, which is actually a mandatory requirement, or rather a requirement that is sought for by the parents because they need it for admission to primary school. The adult vaccinations recording, unfortunately, is not a mandatory requirement. Hence, when the pharmacists, if they are to solicit the history of the vaccination, they probably cannot totally rely on the records in the NIR. They probably need to look at dispense records as well in our National Electronic Health Records, and as well as interview the patient. So we thought that one of the things that we could do is to draft up a guidance document to assist the pharmacists to actually navigate these reconciliations. As we have not actually transitioned fully to the immunizer role, we are not sure in terms of what is the acceptance level of the public in terms of the pharmacist-led vaccinations. I guess one way around it is that we thought that we should just continue and step up our public advocacy and educations to boost the image of the pharmacists, to share with them that we indeed are knowledgeable in this content of vaccine, as well as and we also try to, within the public restructured hospital, which already started in a small way, continue to step that up and hopefully bring value to the team, and with that, boost their confidence of us able to also transition from the advocacy role to the immunizer role. Next. So if you are to sum up all the ingredients that we felt that is necessary to actually push for a successful vaccination services, it will be in this slide as follow. First, two keywords will be the consistent and recurrent public education that we felt that to continue to hammer on and to inform to the patients that what is the importance of the vaccination, as well as to build up the image of the pharmacist ability to do so. Unity from our pharmacy managers and leaderships to complement this public advocacy to drive the change in all sectors. In addition, work closely with our academia as well as our training institutions to build up the training resources to have a consistent run so that more and more pharmacists are able to be trained to be ready to take on the vaccinator role. We actually in Singapore, we felt that if we are to start the vaccinator role, we will also want to start small to actually build the confidence within the team or within the professions. So we're looking at the needs, mostly actually influenza, which has the highest needs. So we thought we would start small with the influenza vaccine first to build the confidence within us, as well as to build the rapport with our healthcare professional to let them see the value of our involvement. Last but not least, as I mentioned, which is the most important point, is how to actually commence that negotiations or discussion with our regulator, our Ministry of Health, in terms of change of registration, legislations, as well as payment scheme to facilitate the changes. Okay, that's all for me. Thank you very much. I welcome for any question thereafter. Thank you.
Thank you very much, Yong. That's it's been a very interesting journey for you in Singapore, and it'll be interesting to see how that compares with a number of our other presenters. Our next presenter is Dr. Faraz Ashraf. Faraz graduated with a Doctor of Pharmacy in 2008 and immediately joined the Ministry of Health, the government of Pakistan, and in the same year was appointed as a hospital pharmacist in a children's hospital in Lahore, which is amongst the highest ranking facilities in the country. Faraz was promoted to Deputy Director of Pharmacy in 2014, and in his tenure, he has served in many of the areas of the hospital, including administration, compounding, dispensing, drug sampling, community pharmacy section of the hospital, and other related departments. In the meantime, Faraz has also completed his postgraduate studies in pharmaceutics. Welcome, Faraz.
Thank you, Paul. Thank you for the wonderful introduction. Good evening, everyone. I'm Faraz Ashraf from Pakistan. Currently, I'm working in the Children's Hospital and the Institute of Child Health, Lahore. So let's begin with my presentation. Next, please. First of all, I'd like to tell you all, in Pakistan, we do not have any particular law supporting the pharmacist for vaccination. What we are doing is on our own basis. So how a pharmacist can act in the vaccination, like an educator, facilitator, and immunizer. There is no such policy who supports the pharmacy and the pharmacist in incorporating vaccination to the patients. The policy and strategy which is being followed is, first of all, the incorporation of pharmacists at the very primary healthcare facilities and private clinics. So how a pharmacist can perform as an educator? Previous one, please, back. The first point is how a pharmacist can perform as an educator. Pharmacist can respond to the specific questions, like he can perform in the Drug Information Center for a particular query. Secondly, The identification of patients in need of specific immunizations, the patient's counseling, and the administrative roles played by the participation to develop immunization-related policies and procedures. And there are a variety of healthcare settings like a pharmacist can perform in community pharmacies. There he can inform the patients or the patients coming to buy the medicines for their education about vaccination. Then how pharmacists can perform as a facilitator, assist in vaccination delivery, like includes the medicine, maintenance of cold chains, immunization clinics held in the pharmacies, immunization provided by other healthcare providers. Pharmacists can assist other healthcare providers in providing the vaccination. Many adults prefer the previous settings, the traditional settings like the annual influenza immunizations. Many people are getting this vaccination annually. The pharmacist can help those and facilitate those patients who are annually getting the vaccinations or for like traveling. Then pharmacists can be as an immunizer, provide immunization to the public in those jurisdictions where the function is within the scope of the pharmacy practice. Next, please. What barriers they had to overcome? There are limited number of commercial and government health plans in Pakistan. We don't have the support of the government, so we have to buck up, we have to initiate different plans and talk to government about all these vaccination plans in which they can incorporate pharmacists. Like lack of patient share record system. We don't have any system which shares the record of a particular patient, the vaccinations. Then the financial barriers as the third world countries, the political barriers where the governments are not accessible, the government people, we have to wait for many months to meet them and to advocate about the pharmacists for being incorporated in the vaccination. And then the lack of trainings. There are no such trainings for the pharmacists. Be back, please. There are no such training for the pharmacists, excuse me, and the health professional dealing with the immunization process. There should be proper training sessions for this. Next. What have been the major drivers for transforming vaccinations in the region? So the cold chain maintenance is the very first point. The basic vaccination strategy is this, following the cold chain maintenance. The regular meetups with the health officials and the government officials, and for the advocacy of pharmacists, for the pharmacists in the vaccination systems. Then there can be a master training program to train the very few and expert pharmacists who can train the other pharmacists in community pharmacies, hospitals, and others for vaccination. And the establishment of vaccination centers in the community pharmacy setup, because the community pharmacy setup is the very first point where the patient meets the pharmacist or any healthcare provider. So there the pharmacist can advocate and can inform about the vaccination procedures and the vaccinations which are necessary for the particular person or their kids, etc. Next, please. What insights do they have for other countries wanting to advocate for pharmacy vaccination? The very first step is the incorporation of pharmacists at the very primary healthcare facilities. The primary hospital, like in Pakistan, we did not have the pharmacists at the very first level, but now we have incorporated pharmacists even at district levels or in private clinics. Now they can perform different functions. They can make and they can establish their pharmacies in the healthcare environment, healthcare facilities. They can visit vaccination centers. Although we don't have the law, but they themselves can put some efforts to incorporate pharmacists in the vaccination. Then there should be regular training for the pharmacists on vaccination, and the proper training of mother and proper training and at the mother and child care center when the mother During her pregnancy visits, the mother and child care center vaccination chart should be given to her and about her and the kids. Then proper vaccination centers should be established at every healthcare level. And there should be strict supervision of the pharmacist. Then awareness in the parents regarding the vaccination of their children. As in Pakistan, the parents do not care much about the vaccination, especially in villages and other backward areas. And then lastly, the professional associations should engage health ministries and officials and the governments to incorporate pharmacists in the vaccination centers and the incorporation of pharmacists at very primary healthcare facilities. Thank you.
Thank you, Firaz. Very interesting, and it is interesting indeed to see the barriers within Pakistan to pharmacists offering vaccinations and the various stages and the challenges that are in front of you there to get broad-based scope of practice adoption of pharmacist vaccination. Thank you. That was a most interesting presentation. Our third presenter tonight is Mrs. Manjiri Garat. Manjiri is an academic working with Prin KM Kunnami Pharmacy Polytechnic near Mumbai in India as in-charge principal. She's the Vice President of the Indian Pharmaceutical Association, the IPA, and Chairperson of the Community Pharmacy Division of IPA. She's an EXCO member of CFARM Forum, the immediate past Vice President of the Community Pharmacy Section of the International Pharmaceutical Federation, and a newly elected Vice President of FIP. Apart from her academic and administrative responsibilities at her institute, Manjiri has been active in the area of community pharmacy and consumer medicine education. She was instrumental in establishing a public-private partnership engaging community pharmacists in the TB DOTS program. Manjiri is also involved in professional development of pharmacists through training them for various aspects of good pharmacy practice to help them play a vital role in public health and to promote responsible use of medicines by both pharmacists and patients. Manjiri received the Fellowship of IPA and several other awards from social and professional organisations in her country. She is a recipient of 2 global awards. One is the Fellow of FIP in the year of 2016 and the Ishidate Award of Federation of Asian Pharmaceutical Associations, FAPA, in 2018 in recognition of her services to the pharmacy profession. Welcome, Manjiri.
Thank you, Paul. Thank you for this kind introduction, and thank you, FIP, for this opportunity. Happy to be in the panel of experts where we can learn a lot what's going on regarding the pharmacist and vaccination in other countries. Before I start with my slide, let me just give you a brief introduction. India is a huge country. I hope everyone knows about it. It's 1.3 billion people. And the pharmacies, the community pharmacies in India are about 700,000. That is 0.7 million pharmacies are there in the nook and corner of the country. They're mostly the single owned, that is brick and mortar pharmacies. And we have now entry of few chain pharmacies in our country. But mostly we still have the single owner pharmacies everywhere in the country. Though, as everybody knows, that India is called pharmacy of the world, and we are the major exporter of the generic drugs to the entire world. The pharmacy practice, though the industry developed a lot, the pharmacy practice in India has been lagging behind, and we are still at a development stage, struggling to have more larger role for the pharmacist in India. Regarding the immunization, the vaccines in India fall in the Schedule C of the Drug and Cosmetic Act. And we have our national immunization schedule, and the vaccines are highly subsidized or given free of charge from the government health facilities. With this brief introduction, I would like to tell you that we at Indian Pharmaceutical Association, we have been advocating with the government of India for the larger role of pharmacists in various national health programs. Just now, Paul told you about the DOTS TV pharmacist project. So we were successful in engaging the pharmacist in the national TB control program. And our efforts are on to convince the government that pharmacists can play important role in the national immunization program. Currently, as my colleagues from Singapore or Pakistan said, we do not have any law or we do not have any supporting policy framed by government to include the pharmacist in vaccination. So I'm talking about the pharmacist in the hospital setup, the primary healthcare centers, as well as the pharmacist in the community pharmacy. What we have seen so far, the involvement of pharmacists has been as a part of Pulse Polio campaign. Some of our community pharmacies and some of our hospital pharmacies have been contributing to the Pulse Polio campaign. But more than that, we do not have right now any role played by or any contribution of the pharmacists directly in the vaccination program. Pharmacists are concerned, but what we have been doing is we're trying to show our pharmacists that their global counterparts, Emma, can I have the slide? Yeah. Their global counterparts have been playing a big role in they're contributing to the vaccination. They have been injecting the vaccines through their community pharmacies. So we're trying to sensitize our pharmacists in India through continuing professional development programs, articles written in the magazines and their bulletins. And we're trying to make them know that there is an expanded scope of practice worldwide for the pharmacists. But pharmacists in India have remained more or less as a medicine dispenser or a drug seller, and we haven't yet seen the expanded practice for the pharmacist in India. In the recently taken decision with the background of COVID-19, Indian Pharmaceutical Association along with the Seer Farm Forum, we have decided to appeal and promote to the government to consider the inclusion of pharmacists in the immunization program. May I please have the next slide? Regarding the pharmacist and vaccination, myself along with my colleagues had done one project in 2018, and we had surveyed around 500 community pharmacists for their opinions about what they feel about the vaccination, what are the barriers, what are their expectations. So the barriers which we found, as my colleagues already said, now the community pharmacists said that they have excessive workload. As you can see in India, there are a lot of people all the time in the pharmacy. So excessive workload, and we have shortage of staff. So it will be difficult to do any additional new work. It will be difficult to take any additional new responsibility. Also, they said that we don't have any education. So our pharmacy curriculum, though we include the portion, the syllabus on vaccination, they don't have any practical orientation given during their undergraduate studies, as well as we don't have any specific training towards vaccination. And there is a lack of clarity if there exists any relevant policy for such new role. So they were confused whether if we start doing such thing, whether the government will support, is there a legal framework, is there a policy which is enabling us to do so? So these were the main barriers which we found in our study in year 2018. Next slide, please. Also, this study revealed that pharmacists have interest and are very keen to participate. It's not that they were shying away from this new role. They were interested to participate in the vaccination program. In fact, all 100% said that we can contribute to an extent in the vaccination program. And about 90% of the pharmacists, very interestingly, did not expect as such any monetary incentives. As you know, we don't have any remuneration model strategy or remuneration models. So they did not expect that they will get some money or financial incentives, but they did expect that they should get some non-financial incentives, kind of recognition or an accreditation of a pharmacy as if they get involved in vaccination. So like they wanted to be a partner of the government in performing this duty. Pharmacists do stock the few vaccines in the pharmacy, such as diphtheria, pertussis, tetanus, or hepatitis B. It's not very common in India to give a flu vaccination. So we don't have flu vaccination in India. And so these were the barriers, and this was the opinion that we found from our pharmacist colleagues. Next one. Next slide, please, Emma. So now what do we plan to do? See, the vaccination coverage in India, unfortunately, is not at 100%. We still are around at 81% of vaccination coverage if we consider the entire country. So there is huge scope to improve this vaccination coverage and to ensure that every child is vaccinated for the entire immunization schedule that we have. We have, as I said, about 0.7 million or 700,000 pharmacies in every nook and corner. So if the pharmacists, even if we could involve few percentage of pharmacists, with of course the due training, that can strengthen the health system as well as it can share the burden of the health system. So what we are planning now, learning from other countries and learning from FIP, at stage 1, we would like our pharmacies to be center of awareness for the community, counsel and educate the community, especially in rural areas, to ensure that the vaccination is done, schedule is followed. And pharmacies can tie up with the local health authority to do so, to ensure the maximal coverage. And for this also the training will be required. And this at stage 2. So once we have built up some confidence, and once the other healthcare professionals, the health system, the government has developed some confidence that pharmacists are definitely wanting to contribute, then at stage 2, we would like to train the pharmacists for injecting vaccines and then develop a supporting policy for the same to enable them to facilitate delivery of vaccination through the recognized and trained community pharmacists. Also, we would like to have pharmacists in pharmacovigilance program to report any adverse drug reactions to the vaccination. So we would like to run a pilot in few states for learnings and then scale it up by approaching the government. So this is going to be the way forward. And I admit that it's a long way to go for us. It's kind of a struggle. It's an uphill task, but we are determined to do so, especially when we saw in the COVID-19 pandemic, there is so much shortage of the healthcare workers in the system. And so we are determined at IPA and CFR Forum that we will be definitely advocating for the larger role of pharmacists, and especially in the immunization program. So that's it from India right now. And thank you very much for this opportunity again to FIP. If there are any questions later on, I'm happy to take it. Thank you, Paul. Thank you, Emma.
Thank you very much, Manjiri. And you've started the journey, and you've got a challenge with so many people,
Yes.
and such a big country, and so many pharmacies. But it is a stepwise approach you need to take, and I think that that journey looks like it started for you. Thank you very much.
Thank you, Paul.
Our next presenter will be Indra Trezio-Kiernan. Indra is the chair of the Public Pharmacy Commission of the Lithuanian Pharmaceutical Association. She graduated in 2004 from the Faculty of Pharmacy at Kaunas Medical School. She has worked as a pharmacist and a general manager of a small chain until June of 2017. From 2017, she worked as a lecturer and junior researcher at the Pharmacy Centre of Vilnius University. She is now a PhD candidate at Groningen University, and her dissertation topic is pharmaceutical care services for patients with high blood pressure. She's an active member of the Lithuanian Pharmaceutical Association and has been active in FIP since 2015. During the past 2 years, Indra has organised and chaired FIP-endorsed conferences on immunisation services in pharmacies in Lithuania. She's a member of the Immunisation Services Implementation Group in Lithuania, and we welcome Indra.
Thank you, Paul. Hi, my colleagues. It's a pleasure and honor to be here today and to present the path that we went towards pharmacy immunization in Lithuania. So, as originally and historically in most of the countries, pharmacies and pharmacists in Lithuania are considered as medicine providers, like dispensing services. And as we have a huge society, like 3,000 working community pharmacists, it's not like in India, but the country is small. So we have a huge society of high qualification professionals that are considered only dispensing pharmacists. First, the idea to present, to advocate immunization services as a pharmacy, part of the pharmacy work, was introduced in 2015 by a pharmacy chain. It was just a first glimpse to what we could do, and unfortunately this was not a successful start. And then in 2018, we started active promotion of the immunization services at the pharmacy, and that were like introduced in 3 parts. We advocated immunization services to health authorities, like to health ministry and to politics. Then we introduced immunization services to healthcare professionals. We advocated that pharmacists are healthcare professionals that could provide health care. And also we advocated immunization services to pharmacists. And yet there is still a huge work to do, but as for now, at least first part of our advocating actions are considered successful, because now we have the group of that has to introduce the immunization services into the pharmacies, and possibly we will have this possibility for Lithuanian pharmacists from 1st of November this year. So now I will ask to next slide, please, and I will talk about barriers that we had to overcome to be at this stage that we are now. So first we had resistance from pharmacists and resistance from physicians because, as I told, the pharmacists were considered as medicine providers in Lithuania. By this I mean that pharmacists are considered healthcare professionals, but are not considered healthcare providers in Lithuania. So they can, talk about medicines, but can't actually provide health care, can't touch the patient. And I guess it's everywhere. In a lot of countries, we have the same situation. So this was the resistance both from pharmacists and the physicians that we had to overcome. Then we have our healthcare system is complex, and pharmacy is not considered as a healthcare practice. It's considered as a pharmacy care practice. So we had to overcome those barriers as well. What we've done for now, the pharmacists will have an additional, like on top of the pharmacy profession, they will have, they will be like expanded practice pharmacists that can have that can do the shots. So they will have like an additional license to do the shots. So this barrier is pretty much overcome. The other barrier is that we don't have reimbursement and have no incentives for vaccines in Lithuania. The vaccination services are paid by the government to GP as a general healthcare service. So there is no incentives for the pharmacy to do this this service. And if the patient will come to the pharmacy to do the shots, they will have to pay over it out of the pocket. So those were the major barriers. And then the other thing that the pharmacists can't access patients' healthcare profile. We have a very nice e-health platform where all the healthcare profiles of the patients are collected. And this barrier is also agreed to overcome, and the pharmacists will have a possibility to access patients' healthcare profile at least to record the shot that they've done. Next slide, please. Why we need this transformation? Why we need the vaccination services in the pharmacy? Because as I told, we have a huge society of high quality professionals in Lithuania, and we need a transformation of our profession, and we need a professional recognition. So this was the major driver for our pharmaceutical society to move forward and to advocate and to influence the policymakers to give a possibility to pharmacy to do the vaccination services. Then meeting the community need of immunization services, we recognize that there are a lot of healthy members of society that do not go to the GP and do not take their shots because they just simply don't have time, and the pharmacy service could help those members of society to get the vaccines in this way. Then the need from our government, for our health authorities, was to increase vaccination coverage in Lithuania. And for example, for seasonal flu, we have only 24% of coverage in Lithuania, and this is not enough. So health authorities saw the pharmacists as the ones that could improve the vaccination coverage, at least in the flu light. And then an additional thing was that, as we discussed on the possible services, we agreed that possibly in the future, when we have COVID-19 vaccines, those could be provided by the pharmacist to get a huge coverage, like in short time. So those were the most major drivers to introduce, to go this way and to advocate towards immunization in the pharmacy. And what we could suggest other countries that would like to introduce, or to just at least to start the journey towards immunization in the pharmacy. And what we did, and we think that was successful, we advocated pharmacy profession and competences everywhere we could. In healthcare, policy meetings, in health ministry, to other healthcare professionals, to GPs, we advocated the competence that we have. Also, we organized meetings and conferences, and 2 huge conferences that I've chaired for the physicians and pharmacists both. Not like a pharmacist conference, but we invited also physicians to attend and talked about immunization. And I'm really grateful and thankful for FIP President Dominic Jordan and our dear friend Gonzalo Sousa Pinta for helping us and getting the FIP endorsement for those conferences, because what we think that this helped us a lot, and this is what I would recommend for other countries to do: seek FIP endorsement for your events, and this would really be seen in your society. And what we also did, and I would recommend for the other members and other countries, find the key opinion leaders in the GP society, in the health authorities that could advocate and support you, because this was really important, and I think we succeeded in this as well. So I guess I should wish everyone good luck and success in this way towards vaccination in the pharmacy. Thank you.
Thank you very much, Indra, and some interesting insights again. In particular, when you say that in Lithuania, pharmacists are healthcare professionals but are not seen as healthcare providers. Yes. That's a very interesting insight. And I think one of the easiest ways to change that would be to have a vaccination or an immunisation service delivered by highly accessible, highly trained community pharmacists. So Yes, it's interesting, and that's a perception, obviously, that all that advocacy hopefully will change. So thank you very much for that. Our next presenter is Samira Shamas. Samira is a registered practicing pharmacist. She's an activist on the international, regional and national levels, promoting the role of the pharmacy profession as a healthcare provider within the healthcare system, focusing on patient and medicine safety. Samira owns a community pharmacy, is a lifelong practicing community pharmacist, and is also a director of one of the leading wholesale companies, being representative to a group of multinational companies in Jordan. This diverse experience in the supply system renders Samira with a high profile and advanced knowledge in the regulatory affairs, drug pricing, marketing strategies, supply management, as well as the tender business. Samira is a past member of the Community Pharmacy Section Exco of FIP and is currently an FIP Vice President and a serving Bureau member. Welcome, Samira.
Thank you, Paul, for the introduction. And definitely, I'm very glad to be among colleagues all over the world, sharing our experience here in Jordan. Our journey within immunization started when I first attended the advocacy summit that was held in Amsterdam in 2018, held by FIP. It was really inspirational. On going back home, I submitted my report to our association, asking them seriously to start working on immunization. Next, please. No, I need the first one, please. Yes. To my surprise, almost after 10 days from my report, I received a letter from my association asking me to form a group of pharmacists to start working on the project. We did a group of diverse experienced pharmacists, and on our first agenda, we had to answer these two questions. Vaccination is everyone's problem. Can pharmacists be part of the solution? So we start to, next please. We started to brainstorm about the issue to find that, yes, implementation of immunization in the community pharmacy as a health service, partnering in healthcare. Next, please. We did a situation analysis. We looked into all external and internal factors that affect the profession, and we found that mainly most of the issues are well taken by the profession. Next, please. Then we have to look into what currently our pharmacists are doing. Are they We had a checklist to see if we have skilled staff. The answer was yes. To have controlled conditions, it's yes. National reach, all distribution of pharmacies and long opening hours. Supply chain, yes. Reporting and feedback, yes. So the checklist was super, and we ended up with the second phase of our looking into our immunization project. Next, please. Now, if you want to start working on immunization, what's an added value will be for the profession? We looked and we ended up with 6 principles. Increase visibility of the profession, bridge relation with health policymaker, strengthen commitment to the profession, trusted relationship with patient and community, improve economics of community pharmacy, and improve accessibility to vaccination, which is the core of our business. Next, please. We looked into some models worldwide, and we were really impressed to see how they are improving. Like in Argentina, they started in the USA, all over the world. I think it was reported a few days ago that something like 26 countries already are performing immunization. Next, please. We wanted to look into the list of potential resistant barriers. And we found out that the legal barriers will be the main pretext for us to work with. So what we did next, please. What we did, we have 4 laws that govern the profession of pharmacy profession in Jordan. We screened them all. Unfortunately, we could not find a slit or an opening or a window to go through the legal part. Then fortunately, we hopped into the vaccination guidelines for the year 2009, and it was in Article 5 and Article 6 that we found what we wanted. In Article 5, it's a translation, permission where to have the vaccination is any center that MOH accredits in line with Article 28A of the Public Health Law, and which complies with the pharmacy. And Article 6, vaccination service is offered by health official being qualified and trained for this purpose. And this will, the pharmacist will comply with upon being trained and accredited. So we find our refuge in these 2 articles. Please, next please. We submitted 10 recommendations to our association, mainly to introduce the concept of pharmaceutical care and to have a new definition for the role of community pharmacists in line with pharmaceutical care. We needed also to be part of the activity for immunization. Next, please. What was remarkable about our work, we commissioned a company to do a survey to our market in 2 tracks. The first one, next please. It's in 2 segments were interviewed in the study to capture the below objectives. Pharmacists to check their acceptance and attitude for being immunizer. And the second track for the public, their acceptance and attitude to be immunized by the pharmacist in the pharmacist. And to our surprise, the result was tremendous, knowing before having the training to the pharmacist, it jumped like 50% to our advantage. And that was one of the main issues that helped us when we went along lobbying for our case. Next, please. We moved into having a guideline. It was based on our national immunization guidelines. We have one of the best programs in the region, like 92% of our people under the age of 18 are fully immunized, free of charge. And so we decided to have our national immunization guidelines. Of course, we looked into other European and Canadian guidelines, and we sought some help from them. It's in both English and Arabic. Then we prepared, we came to the final step of our endeavor in immunization, and we prepared a training. We proposed a training. It involves 5 modules. Next, please. Next, please. The first module consists pharmacists, vaccines, and public health. Second module, overview of immunology and vaccine development, vaccine preventable disease, patient care consideration for immunization pharmacists. These 4 modules will be virtually given, and the last module will deal with CPR, first aid, and practical training for injections. We finished within our working group. We submitted our recommendation to our JPA, Jordan Pharmacist Association. At that moment, we started to lobby outside the association. We contacted our Minister of Health, who was very, very, very supportive. He's a cardiologist. He liked the idea, and he immediately formed a working group with from the ministry, legal advisor, and we met more than 10 times with them, discussing whatever we planned in our committee. And it was very extensive discussion. By the end, it was in August 3rd, we received the approval from the minister, approving the pharmacist to be an immunizer after being trained according to our modules, and the pharmacy to be accredited with certain conditions. Now we're in the period of preparing our training to deliver to our pharmacists, preparing them to take over their duty in society. This is in general what we did during the last 2 years. Because of Corona, it was delayed. Otherwise, it was fine. By the end, it was a positive result. And we thank definitely our MOH for the stand supporting the pharmacy profession. Next, please. And to answer our first slide, yes, we as profession strongly believe in this, along with our leadership, setting the roadmap for this vital service by offering a well-developed educational program that is technically strong, be proven to deliver the desired objectives, must prepare pharmacists to deal with these objectives. Next, please. And by the end, I would like to deliver a message, take-home message. Impossible, it's a word in the dictionary, we believe in yourself, in your profession. Pharmacists should be on the table whenever medicine is to be discussed. Set your priorities, plan, and lead, and you get there. Thank you. This is a campaign. It was offered by our group for the elderly people last year. We're planning to have the same again this year. It was really a big success. It was all over the newspaper. Thank you.
Congratulations, Samira. And I think anyone who listened to that presentation will see what a great job that the JPA and yourself have done in delivering that service to the Jordanian community. And interestingly, I think you made the point that you had continued discussions with the ministry and the policymakers. And I think one of the key take-homes is that you must engage them. They need to be part of the journey because you can't do it without them. And you need to engage them very early in the process. So thank you. Just one question, Samira, do you have, as part of your undergraduate training, vaccination training, or is it all done post-graduate?
That was one of our recommendations to bridge the relation with School of Pharmacists, so they won't pump new graduates with no information or experience with. They have started to do that.
Excellent, excellent. Yes. So thank you, Samira. We'll now proceed. For those who are joining us, the culmination of this series of digital presentations will be an FIP call to action to expand the role of community pharmacies in vaccination, including against COVID-19 and the potential for other future pandemics. Next slide, please, Emma. No, we might just go back to the call for action if we can. And there should be, I might just expand a little on the call for action because FIP, as we've heard, is a very valuable ally when you are looking to develop this vaccination service in your countries. And FIP will call on governments and other stakeholders to implement the following measures: to recognise and fully harness the potential and convenience of community pharmacies for public health, primary health care and disease prevention strategies, including vaccination; to foster the full integration of community pharmacies in healthcare systems by creating the regulatory and operational conditions for interprofessional collaboration, including access to shared patient health records and vaccination records; to expand the regulatory scope of practice of appropriately trained and certified pharmacists, to authorise them to administer vaccines beyond infancy, including a broad range of vaccines; to promote the competence of pharmacists in vaccine administration through the development of the required knowledge and skills as an integral part of the pharmacist's foundational education and training, and/or through continuing professional development opportunities. FIP will call on governments and stakeholders to invest in prevention strategies, including vaccines and vaccination services by all providers, including pharmacists, to ensure equity in access to vaccinations and the sustainability of those vaccination services; to ensure health system readiness for mass immunisation against COVID-19 and any future pandemics as soon as vaccines are available; to include pharmacists in emergency preparedness and response plans as frontline health workers. These measures are urgently needed to ensure equitable access to vaccines and vaccination services to people around the world, across all ages and leaving no one behind; to reduce the burden of vaccine preventable diseases, and so that pharmacists can play an even greater part in the fight against COVID-19 and any future emerging pandemics. I just would recommend that anyone who needs any of the resources that we have shown tonight to utilise the website transformingvaccination.fip.org, and also there will be a publication early next year which will be a collection of all the significant messages and moments that are part of this full digital series on vaccination. We now move to question time. Please, Emma. And Emma's just going to
Hello
bring
all.
up the question. Yes, Emma.
So we did manage to answer some of the questions whilst speakers were giving their talks. There is one. It's really just one comment or request to Samira from Lakmore Bunu, asking whether Samira would provide them the curriculum that they used in Jordan for possible adoption in Zimbabwe. And there's an email address in the chat box. So if Samira could take good note of that, that would be fantastic, sharing information about the curriculum that was used to train pharmacists. Then we have maybe a comment, and Paul, maybe you can see how you would like to address this. There is one comment from an anonymous participant saying that it is a huge barrier for community vaccination programs because when we don't have full dispensing rights, because patients have no incentives to visit the pharmacy. I think that in any case throughout the presentations, good comments were made in terms of having to precede all the training and the work to actually prepare the pharmacists with a good advocacy campaign, both to the population, but also addressing the politicians and the other healthcare professionals to get them on board. I don't know if you would like to further comment on this and the fact that sometimes legislation and the way that patients perceive the role of community pharmacists may be a barrier to the development of this service?
Certainly, Emma, yes, that can be the perception. However, pharmacists are trained as medicine experts, and vaccines are well within the remit of pharmacists as medicine experts. Other things that are a critical part of vaccination delivery, such as cold chain, in many countries now, pharmacists are recognised as cold chain experts. So a lot of the infrastructure that could be a barrier to provision of vaccines has been overcome. So yes, there are difficulties, and every journey starts with a small step. And it's whether the barrier be access to vaccines via dispensing protocols. Well, that might be the starting point for advocacy for that particular country in their journey towards offering full vaccination services. Because at the end of the day, community pharmacies in any jurisdiction are the most convenient, most accessible primary healthcare providers. So I just welcome any comment from our other panelists if they wish to make a comment. If you'd like to come in now, if you could just unmute and start your video. So Yong, do you have a comment there?
I guess, yeah, hi.
Thank
Okay, Manjiri, you want to go first?
Yong, please go ahead.
Actually in Singapore, pharmacists also do not have the dispensing rights. But it was actually quite, we thought we had the same struggles. But in fact, during this pandemic situation, we see actually an improvement in our professionals' standing. In fact, we started to see that a lot of patients and publics come to us because during the pandemic, especially due to the circuit breaker, only pharmacy are open. So actually we become the accessible lots to address the needs. So I felt that to this anonymous questions, I don't think it will be that depressing, to be honest. I felt we could do more in other areas, such as the minor ailment consultation, even if it is not dispensing or prescription medicine, health promotions. I think that's what the Singapore pharmacists felt, that we could step out in other areas. And in fact, our community pharmacists has stepped up in terms of not just in their shop floor, has also gone into the nursing home. So there are many areas for you to branch out to actually promote your professional abilities. So that's all for me.
Thank you. Manjiri.
Hello. I agree with Yong when she says that the professional standing of the pharmacist improved during the COVID pandemic. Same experience we have in India. And just one piece of information which is quite interesting, that we saw when there is healthcare worker shortage and when the local governments appealed for the volunteers for the COVID testing. Many of the pharmacy students came forward and they became the volunteer and they participated. I mean, they acted as a technician for the COVID-19 RT-PCR testing. So that was something very encouraging to see, that the pharmacy students coming forward as a volunteer for the COVID-19 testing, the RT-PCR testing. So eventually they would be becoming the pharmacists, where they would already have the great insight from what their experience now. And I agree that the consumer sensitization about the role of pharmacist on one side and advocacy with the government, the ministry on the other side, both are two important ways to improve the role of pharmacist. And I'm inspired by Samira's presentation and a lot of learning from Jordan for us here to start our journey of 1,000 miles. Thank you, Paul.
Thank you, Manjiri. A question, if I might, to Indra and to Samira, where you have had some degree of success in pharmacist vaccination. Can I ask, just for the benefit of other pharmacists who are part of this tonight, How important was it, or did you have a pilot to start the vaccination process, rather than trying to have a large number of trained pharmacists all at one time? Did you engage in a pilot program with perhaps vaccination for influenza? Indra, you might
Yes.
start off, and then we'll go to Samira.
Yeah, thank you for the question. Actually, we did not, and we sort of piloting the services in like a volunteer pharmacy, but within COVID-19 situation, it actually moved really fast towards vaccination in the pharmacy. The situation is that when we are allowed to do vaccination in the pharmacy, this would not be mandatory. The pharmacy can choose whether they want to do the service or they don't. So this will be like live pilot, in the life, whether it would succeed or no. But we hope and we think that this will be a really kick for the pharmacy profession for the future. And to tell that, COVID-19 situation also showed the pharmacy profession and competencies in this light of the, of the close of the GP offices and all the things. But the other thing is that in the way of this epidemiologic situation, now we have, like higher implementation barriers, because now in the pharmacy you have to, as in healthcare facility, you have to have an additional room to, to change and to, all the things that were not there before. And now we have to another implementation barriers that, we haven't thought of in advance, but this is the way it's, pros and cons.
Thank you, Indra. Samira.
Yes, Paul. I think, yes, definitely we're planning to have a pilot study for something like 10% of our community pharmacists this season. Nowadays, we're working on having the training modules accredited by the Higher Board of Health. And we're working on a marketing plan by our JPA for both the pharmacist and the community for acceptance of the idea of immunization. One main point I would like to raise that recently last year by our JFDA, it was exclusively issued a kind of not law but a guideline that vaccines should be sold only in pharmacies. Previously, doctors used to buy vaccines and keep it in their clinics. Nowadays, only exclusively through pharmacies. This will enrich the role of the pharmacist to provide for the supply, maintenance, coverage, as well as even information to be given to the right patient. Yes, we're planning on a pilot study and hopefully to monitor and see if anything goes well, then we can spread it all over, because we were given the acceptance for the flu vaccine. Now we'll be working also for the coronavirus whenever it's available. So it will be a step towards the coronavirus too.
Excellent, excellent.
Thank you.
Emma, do you have any comments you'd like to make before we finish up tonight?
No, thank you, Paul. We have a lot of people just asking Samira to share models, information, and other kind of information that can assist other countries, and that's specifically what we are trying to do with this series, is to collect a lot of evidence and what has worked well, and transform it into a toolkit that countries and individual pharmacists can do to implement vaccination services in their country, from the advocacy stage, going through education and training for pharmacists, and actual implementation in pharmacies, and also obviously evaluating and assessing the patient satisfaction about the service, and also how the implementation goes, because that's a positive feedback that we have then to feed back into other countries and the own government to continue to evolve in terms of the number of vaccines that pharmacists can provide, and in terms of really being involved in the government's strategies to ensure good vaccination coverage in the country. So those were my final comments. I don't think we have additional questions from the audience, Paul, so back to you. Thank you.
Thank you. Thank you, Emma. And it's worth noting, you mentioned the FIP vaccination toolkit. That will form part of the discussion at tomorrow's webinar, which is entitled Enabling Practice, Empowering Pharmacists and Removing Barriers. So I would encourage all of you who have attended tonight, the next in the series of webinars will be tomorrow at 1400 CST. And will be another very insightful presentation, particularly if you are starting or part of this, this wonderful journey towards vaccination. Finally, I would like to thank Yong, Faraz, Manjiri, Indra, and Samira on behalf of FIP and Emma and myself for your very insightful, wonderful presentations tonight. I wish all the attendees well. And just also be aware that you can view all the webinars on the website, and we look forward to your attendance going forward across this series of webinars. Thank you again, and have a very good day to all of you.
Well, we have one last question that maybe is important. How do we register for tomorrow's session? At
the website, there is a link at the FIP transformingvaccination.fip.org. But if you go to the FIP website and click on webinars, you'll see upcoming webinars and you can register there. Emma?
Thank you very much.
Thank you, everyone, and thank you for your attention and for your interest and questions. Good night, all.